Today we're going to start talking about the musculoskeletal chapter, the musculoskeletal system, its diseases, and the treatments and signs and symptoms of it, and then we will begin with talking about the giving you basically like a little rundown and review of the musculoskeletal system. So I'm mainly going by the PowerPoint here, but you can look at your textbook as well, as I'll be looking at that as well. And if you'll just give me 1 second, I'm trying to get this thing to cooperate. Let's see. Okay, I apologize about that. I'm ready now, so let's look at the very beginning of the chapter and let's just talk about the interactions of the different parts of the musculoskeletal system. So we're going to talk about the bones, the muscles, and joints. So when a muscle or joint or bone, well, a bone can't contract, but a muscle or joint, tendon, ligament, any of those contract, it shortens the muscle. So if you were to, let's say, flex your arm, it actually shortens the muscle because it tenses it up. So that's what a contraction is. Muscles that span a joint bring about an action at that joint, and it's called an antagonistic action. And it stabilizes the joint and prevents any movements that, could injure you, basically. So the bones of the skeleton are going to provide you with a sturdiness, so you're able to support your weight, and it's going to permit movement of your body. Let's see, going on here. I'm going to skip some of these slides here. Some minerals that are in your musculoskeletal system, we have a calcium and phosphates. Calcium is very important, as you know, because it does build strong bones. These minerals are embedded in collagen within your body, and collagen is the main protein that's found in your bones. Minerals can cause a hardness and a rigidity to the bone, while the collagen can make you have almost a flexibility of the bone. So we need like a good amount of each one to stay the same. We don't want bones to be very soft, and we don't want them to be very rigid and can easily fracture as well. So going on into the bone cells, a mature bone cell is called an osteocyte, and then we also have osteoblasts, and these are bone forming cells, and we have osteoclast. And osteoclasts, which are reabsorbing cells, and these all reside within the bone. So the different types of bone, let's look at that. The different types of bone, we have long bones, short bones, and irregular. Then we have the spongy bones, flat bones. So there's several different types, but every bone pretty much is covered with a layer of bone tissue that's called a compact bone. In spongy bone, the type of bone that is a little porous, contains a lot of bone marrow filled spaces. So again, that's what's called a porous, almost like a sponge. And this red colored marrow is found at the end, or the epiphysis, of the long bones, and this is where your cells start forming. And so you can see, if you don't have good bone health, then you're not going to have good white blood cells, red blood cells, platelets, because almost all of these form in the bone marrow. The long bones are the ones that are found in your arms and legs, and they are long. They have a hollow cavity, and this is called a medulla, or we call it a medullary cavity, and this has yellow bone marrow. And the yellow bone marrow is yellow because it's mainly made up of fats. The growth of long bones has like a little plate at the center called a growth plate, and this is it has like an area of cartilage beside it, and this allows the long bones to grow. And so usually females stop growing around, I believe it's 15 or 16, and males will usually stop growing around 14 or 13 or 14, I believe, are the years, and don't quote me on that. But they all have growth plates that will help them expand and grow larger. If you have damage to the growth plate before maturity ends, then this can cause you to have, of course, you could have dwarfism. There could be a lot of different problems, or you could just have diseases such as osteomalacia, which is softening of the bone. So there's a variety of issues that can happen here. Alright, let's talk about the periosteum of the bone. This is a vascular layer of connective tissue, and it covers the surface of bones, and it contains cells that are able to form new bone, and they serve as an attachment site for your muscles and tendons. So that's what a periosteum does. The different types of joints, you have articulating joints, that you may have heard that before. Articulating joints are the ones where you're able to have a range of motion. Like your elbow joint is articulating because you can move it back and forth from side to side. You can do various things with it, so it's called an articulating joint. So in the way we know where articulating joints is by where it's located in the body and the type of movement that we can do from the body. And we can also look at the shape of the bone that's there. And articulating bones are held together by ligaments, and ligaments are very thick strands of connective tissue that a lot of people can overuse, and it can cause a strain or a sprain. But it's basically collagen, links of collagen, and it causes a lot of strength in the ligament. But again, you can overuse it, it can cause damage. Let's see. Inside the joint, there's a capsule, and in the capsule you have what's called synovial fluid. And this synovial fluid can decrease as we age, and it can decrease worse if we have things such as arthritis and rheumatoid arthritis, osteoarthritis, or different things that are, certain autoimmune diseases. This can cause the synovial fluid to decrease. So the synovial fluid basically lubricates the joint, so it's able to move, back and forth. When the synovial fluid decreases, it's going to, grind the bones back and forth, and then that's what can cause a lot of pain and fractures. The actual sac of fluid that's in this capsule is called the bursa. So you may have heard of a term called bursitis, and that's what that is. It's inflammation of the bursa, or the sacs of fluid. So again, this helps with the friction during movement. Let's see. Let's go on and talk about this voluntary muscles and skeletal muscles. These type of muscles are attached to bones by tendons, and some are attached to soft tissue. The muscles consist of bundles of muscle fibers that are held together by connective tissue. So we have a myoneural junction in our muscles, and that basically helps our muscles to contract and release. And of course, when we contract, it shortens the muscle. Alright, some things to diagnose tests for muscular diseases. We can do x-rays. This is more of a skeletal thing, because we can't really see a lot of soft tissue on x-ray. We may be able to see a slight abnormality, but usually it's bones that we want to look at. So x-rays is one type of diagnostic test. We have MRIs, we have CAT scans or CT scans, joint fluid aspiration, where we can take the fluid out of that bursa and we can look at it under the microscope and see if there's something abnormal going on with it. We can do electromyography and a biopsy, And as well, you know, there's a lot of other things too that we're able to do, but these are the most common. And of course, we want to do the biopsy as a very last resort. So the way that bones can get diseases is a lot of times they can be infected. So they can enter a bone through like a fracture, or maybe, you know, transmission of blood from an infection that was beside that bone. It may have spread to the bone. So there's several different ways that disease can get into the bone. We can also have mineral and vitamin deficiencies, like osteoporosis, that's lacking calcium and vitamin D. So this, you know, will cause that. Bones will atrophy if they fracture, or maybe if we don't use them, they can atrophy, or, you know, we can have like a muscle contraction or contracture as well, where, you know, people are stuck with their arm up like this, so they can't move it because it's been up like this for so long. And then tumors can also develop in bones that can cause disease. So the first disease we're going to look at is osteomyelitis, and that is on page 418. Osteomyelitis is an inflammation of the bone, and it's usually due to an infection. Primarily a bacterial infection is the one that causes this. And what happens is we have infection in the bone marrow, within the ends of the bones, and the long bones are usually the ones that are most frequently affected here, because it usually happens at the end of the bones near where the growth plate was. So osteomyelitis, like I said, is caused by a bacteria, and it's usually either staph, or sometimes it can be a strep bacteria, but a lot of times it's a staph infection. And I know you've heard a lot about staph infections. They can cause a lot of damage, and they can get to the bone. So that's why we have to treat staph immediately. We can also have like an open wound, and that can cause infection to get in. And then sometimes, you know, we can get an abscess in the bone, and this can be very painful and very dangerous because it can kind of compress your vessels, and if it gets in the blood, it's known as being septic. And when that happens, it can reduce your circulation, it can cause tissue death or necrosis. So there's a lot of bad things that can happen from there. Let's see. Some symptoms of bone infection: you're going to have pain, redness, and swelling. Those are your three main signs. Then you may have fever, chills, a fast heart rate, which is tachycardia, leukocytosis, which is basically inflammation of white blood cells, nausea, vomiting. So your main signs of bacterial infection. The treatment for osteomyelitis is antibiotics, and we want to try to catch it early so it doesn't become septic and doesn't become, you know, just where it's a superbug and we're unable to treat it. Sometimes we do have to have surgery to remove the dead bone or the necrotic bone. Alright, let's talk about going on to the tuberculosis of the bone. This is an extremely rare condition, but it can happen. And this is when bacteria, the pulmonary tuberculosis, if you have that, it spreads to the bones from the lungs. So usually this happens in the long bones, in the legs, and the knees. This is where tuberculosis of the bones can happen, if it does happen. Pott's disease, this is mainly seen in children. So Pott's disease is what this is called. And this is usually in the vertebrae of children. And this can cause a lot of deformity and paralysis. The infection has to be treated with antibiotics, and then, but you know, a lot of times tuberculosis, it has a multi-drug resistance. So, unfortunately, especially if the antibiotics are overused, it's going to be very hard to treat. Surgery may have to be done to correct the deformities. And then we go into mineral deficiencies on page 419. Vitamins and minerals like calcium and vitamin D, vitamin C, potassium, these really affect the bones. So calcium and phosphorus are probably the most common here. And we have to have proper bone formation with these and bone maintenance. So if we don't have these, then our bones can get in very bad shape. Dietary calcium has a very hard time digesting and going back into the bones. So a lot of times we'll see patients like with a calcium or vitamin D deficiency, and this eventually leads to osteopenia or osteoporosis. So you have to be careful of that. Rickets. This is another disease of childhood, or it can be shortly after birth as well. So this is when bones do not ossify, or basically they don't harden. So these bones are very soft, they can bend easily, and we can damage them obviously. So the weight-bearing bones in the legs and the hips and feet are the ones that are usually the ones that are deformed. With patients that have rickets, a lot of times have a sternum that's very swollen looking, and it's kind of protruding, and it has bony nodules on the sternums, and you'll have bony nodules on the wrists and the ankles and knees of a patient that has rickets. The skull is usually very large and squared, and the pelvic opening for a girl is more narrow with someone that has rickets. So a female that has rickets may have a lot of trouble later on in life conceiving and having a baby. Other symptoms of rickets are flaccid muscles, which are basically like weak muscles. They may not teeth like they're supposed to. They may have a pot belly. That's a very common symptom. So you can prevent rickets with a lot of vitamin D fortified milk. Sunlight will synthesize vitamin D. And so let's see, going on to osteomalacia. This is just softening of the bones, and this is usually seen in adults. So symptoms for this is going to be muscle weakness, weight loss, and bone pain. And these usually happen on the vertebrae first, and then the legs, and then maybe the pelvis. And so this obviously causes a lot of fractures as well. So osteomalacia is also caused by lack of vitamin D and calcium and phosphorus. So we can treat it with supplements of everything. Then we go on to osteoporosis, which is one that you've probably heard of most frequently. This is porous bone that's abnormally fragile and susceptible for a fracture. Fortunately, this happens a lot of times as we get older, and it usually affects your weight-bearing bones in the back, the pelvis, and the legs. So a lot of times we can have a lot of compression fractures in the spine, and if you see that, then we may want to check them for osteoporosis. Fractures in the hip and the knees and the waist or the pelvis are very common in people that have osteoporosis, especially in women, because females seem to be at the biggest risk for osteoporosis because we already have a small frame. So if you have an extra small frame, you're going to be more at risk. But men usually have a larger frame than women do. So you can look at that figure 15.4 and see the different changes, and slowly you start slouching and you get the humpback appearance, which is also called kyphosis. So let's look at box 15.1 as some risk factors for osteoporosis, and you do need to know this. You can have low bone mass, low calcium intake. Being a female is going to put you at risk. Vitamin D deficiency, small frame or petiteness, sedentary lifestyle, not exercising, just kind of sitting around, not doing anything. A family history, smoking cigarettes, postmenopausal, after your menopause, excessive alcohol use, if you've had a hysterectomy, if you're Caucasian or Asian, and if you do not have a period, or menstrual cycles. So all of these, and there's more too, that are risk factors for osteoporosis. So to diagnose osteoporosis, we usually do something called a bone DEXA scan, DEXA, and these are usually done when a person reaches around a certain age where they have to have one. There's not really a cure for this. We can give the patient medicine, but it mainly is used to keep the calcium and phosphorus and vitamin D from depleting even more. So it doesn't replenish any that's lost. It just helps it from getting worse. So we can also increase our calcium, vitamin D, do exercises, stop smoking, stop drinking as much, and then do your bone density screenings, which is your DEXA scan. Let's see. For treatment other than doing calcium and things of that nature, we can put the patient on hormones that will increase vitamin D and the calcitonin in the blood. And we do that, the parathyroid hormone is the one that basically secretes calcitonin. And so we can do what's called a TSH to test and see how well our calcitonin is doing. Alright, let's go into Paget's disease, and this is also called osteitis deformans. This is like an overproduction of bone, and so all your bone is like, you get it like a thickness of the bone. And this happens usually in the skull, the vertebrae, and the pelvis. So like I said, it's bone softening and overgrowth of bone. So you just have like a overgrowth, bone over bone over bone over bone, and it's just not sufficient enough. So you don't really have any new bone tissue going. So obviously this can put you at risk for fracture. It can cause the skull to enlarge, which can affect your cranial nerves and cause some brain damage or mental disorders. It can also affect your vision and hearing. And it can also cause curvatures in your spine, which is like kyphosis, which is the humpback. Can also have lordosis, which is the sway back, where your lumbar spine is kind of tilted inward. And then you can have scoliosis, which is the sideward curvature of the spine. The etiology of Paget's is really unknown. They think that it's genetically related, but we just really don't know. Sometimes this can lead into a cancer called an osteogenic sarcoma. So we want to really follow this patient. And I just mentioned these, but we're going to talk about vertebral abnormalities, which is your scoliosis, your kyphosis, and your lordosis. So scoliosis is a lateral curvature or side to side, and this can occur usually in childhood, and they will screen for this in childhood. Usually we don't really have to do anything about it until it gets severe, and then we'll do a back brace. And you can see figure 15.5 shows you the different deformities. Let's look at benign bone tumors on page 422. Bone cancer, let's see. Let's look at the benign, meaning non-cancerous bone tumors. This is called an osteoma, which is oma is tumor, so ostea is bone, so it's just plain bone tumor, but it's non-cancerous. So this type of tumor usually does not have any symptoms, and it mainly just be like an abnormal swelling of the bone. And this can affect your mobility of the joint. It can cause some pain, and it may require surgical removal, just depending on the severity. So if we have giant cell tumors, these are usually benign, but they can be malignant, which is cancerous. So on X-ray, when these cell tumors will show up as large bubbles, and then we usually have to remove these surgically. Osteogenic sarcoma, I mentioned that very briefly, but this is usually the most common bone cancer. So it's a primary bone cancer, and it affects the ends of long bones. So the treatment is chemotherapy or surgical removal, but in most cases bone cancer, once we've detected it, it's really too late to do anything. Secondary bone tumors are usually any kind of, well, secondary cancers, period, or anything that has metastasized from one area to another. So let's say we have ovarian cancer, or a patient has ovarian cancer and it has metastasized to the bones. That would be considered a secondary bone tumor. So this is usually will happen by the patient complaining of pain in the bones. They can start fracturing very easily. The ribs and the sternum will kind of protrude, and the skull may grow larger as well. You can look at the fractures on page 423. A closed fracture is any fracture where it does not break the skin. Then you have an open fracture, and this is where the bone exits the skin. And this is where you can have infection in the bone happen. Comminuted, where you have multiple fragments of a bone. Then you have a compression, where they kind of bones sit on top of each other. You have a depressed fracture, where like a skull or a hollow bone is broken in. Spiral fracture is a jagged break, which is usually from like a twisting force. And then we have a green stick, which is just like a little small fracture in the skin, in the bone, and this is usually most common in children. And there's plenty of other ones, but these are the most common that are going to be seen. So you can look over those. Alright, let's look at page 424. We're moving along here. We're going to talk about diseases of the joints. We have arthritis, and arthritis is just inflammation of the joint, and there's different types. We have rheumatoid arthritis, osteoarthritis, gout, septic arthritis, bursitis, sprains, dislocations, and strains. These are all considered some type of arthritis. So we're going to look at rheumatoid arthritis first. Excuse me. So rheumatoid arthritis, it can be very painful, and it usually affects multiple joints. So we're going to have joint pain and stiffness, of course. And the joints are going to be very swollen and warm and very reddened. If rheumatoid arthritis becomes systematic, means it can affect the entire body. The patient may complain of fatigue and weight loss as well. With rheumatoid arthritis, it usually begins with just inflammation, and then it gets worse and worse and worse. And this is called a pathogenesis, how it begins. So, let's see. Let's go on. The cause of rheumatoid arthritis is not really known. It appears to be an autoimmune disease, but that's not set in stone. To test, we can do what's called a RF factor, which is a rheumatoid, or RA factor, a rheumatoid arthritis factor, and that will tell us if the patient has arthritis. Also, within a complete blood count, or a CPC, we have neutrophils, and if we see an increase in neutrophils, we may determine that the patient could have arthritis. Treatment for arthritis is exercise and rest. If it's an acute thing, we mainly just rest. We can take anti-inflammatory medicines, and then we have rheumatic medications as well, like steroids and different things as that. Then going on to osteoarthritis. This is the most common form of arthritis, and it usually only affects one joint, and it causes a lot of pain and a lot of stiffness at the joint. And this will begin to start affecting the muscles, and you'll start having fatigue. Arthritis in the lower back can pinch a spinal nerve, so it can cause a lot of nerve damage. Usually patients with this complain of sciatic nerve pain, which goes right around the very bottom of the lumbar, or the sacrum. Let's see. To diagnose this, we're going to look at the bone ends, and if the bone ends have thickened and they develop little spurs on them, that's a sign that a patient may have osteoarthritis. Sometimes the knuckles and the fingers will become very knobby and enlarged. That's another sign. And usually we can get this just from age, but a lot of times it's injury, or especially repeated injury. So to diagnose this, we mainly just have to do an x-ray. There is no cure right now for osteoarthritis. We just have to do, physical therapy, rest, medication, heat application when it's hurting. We can do steroid. We can do a joint replacement if we need to, or a hip or knee replacement if we need to. Then going on to gout, or what's called gouty arthritis, and that's on page 426, I believe. Yeah. Gout is affects the joints of the feet, and it's from a buildup of uric acid in the blood, and it causes a lot of pain. It usually happens in the big toe, or the knee, or the wrist, or anywhere in the feet. But in the feet, it's usually the big toe is where I've seen the most common complaint of gout. Sometimes it'll bring a grown man to their knees. It's really that painful. So we can give the patient a medicine called colchicine to help with the pain, and it usually happens very suddenly, and once we treat it, it'll go away, and then you never know when it's going to flare up. But one thing that we have to do is we have to monitor what we eat and drink. So we need to make sure that we don't eat or drink anything that's going to increase the uric acid in our body. Symptoms of gout is just extreme pain, redness, swelling. We also have things called tophi, T-O-P-H-I, and it's like a white growth over the joint where the uric acid is basically secreting. Treatment of gout, like I told you, we can use a medicine called colchicine. We can do several different things for gout. Then we go on to septic arthritis. Septic arthritis is a bacterial infection of a joint, and this is where bone and cartilage is destroyed and can lead to what's called as ankylosis, and it can lead to septicemia, which is a life-threatening blood bacteria-borne disease. So we have strep and staph are the main two culprits that cause this. And then we also have gonorrhea. Gonorrhea can also cause this, and it can spread to joints from the blood. Even if we all know about gonorrhea, so it can spread to the joints. Treatment here, antibiotics, very strong antibiotics, so we can make sure we get rid of any infection. Then we go on to bursitis. This is inflammation of the bursa. Causes limited movement, usually affects the shoulder joint, maybe the elbow. Mainly all we have to do here is a lot of rest and applying moist heat to the joint. Sometimes we'll do steroid injections. These can be extremely painful, so we always let the patient know that they are extremely painful before they decide if they want to take one or not. It can cause a displacement. I'm sorry, I'm getting ahead of myself. Let's go on to dislocation. A dislocation is a displacement of the bone. So a lot of people will dislocate their shoulder or their knee or something like that. And that's what it's called, just a dislocation. Finger joints can also, we call it like we jammed our finger, but when they have dislocated it. And symptoms is really just pain. We are not going to be able to move as much depending on where it was dislocated to. Treatment, we have to put the bone back into place, and we have to try to figure out if we need surgery to repair any torn ligaments or anything. Let's see, sprains. This is a twisting of a joint like an ankle. That's the most common thing that's sprained, and it injures the ligaments. So the blood vessels and surrounding tissues can become very inflamed and bruised and damaged. Swelling and discoloration due to hemorrhaging from the ruptured blood vessels can occur, and mainly the only symptoms are pain and inflammation. Treatment, we're going to do alternating cold and hot, especially cold, to reduce the swelling, and then usually after 24 hours we'll then do the heat to try to speed up the healing process. Then we have strains. These are also just basically what called pulled muscles, and this is like a tearing of a muscle or the muscle's tendon. and we could just have overused it, or we could have done it from stretching. So the best way to prevent this is to warm up before you exercise. Treatment is rest, anti-inflammatory medicines, and applying heat to the area. Then we go on to carpal tunnel syndrome. This is like a repetitive overuse of the wrist, and it can cause this. It can radiate up the arm. It can cause a lot of nerve damage. It's usually more severe at night, and it's more common in women than in men. Let's see, to diagnose carpal tunnel, we usually have to do an electromyogram, which is also called like a nerve study or a muscle fiber study. And to treat it, we want to avoid any repetitive movements. We want to immobilize the hand or the other affected area. Injection of steroids. You may take an NSAID like Celebrex or something. And then sometimes we have to have surgery to strip the joint and replace it. Alright, then we go on to muscular dystrophy on page 428. Muscular dystrophy includes all different forms of the disease, and they're all hereditary. These are all transmitted differently, and they affect different muscles, so it really depends on which form you have or the patient has. All forms are going to cause muscle degeneration, so like a breakdown of muscles, and it's going to eventually cause disability, and it usually does that really fast. If we have Duchenne's muscular dystrophy, this is the most common and the most serious type, and this is a sex-linked disorder. So we have more males in this one than we do have females. Let's see. To diagnose muscular dystrophy, we have to do the nerve study or the electromyography, the biopsy of a muscle. We have to do molecular biology testing. And to treat it, we can do physical therapy, occupational therapy, exercise, orthopedic appliances. So there's a lot of different treatments that we can use without medicine being involved. And there is no cure for that. Then we go on to myasthenia gravis. This is a very severe muscular condition, and it's a neuromuscular condition. It's a neurotransmission failure from the nerves of the muscle to the muscles at the myoneural junction. So the symptoms of this is going to be fatigue, the inability to use your muscles. You're going to have like a masked face, a lack of contraction in the facial muscle. So you'll just have a very plain looking face with not really any smiles, frowns, or any expression. The greatest danger for this is respiratory failure, because the muscles are required to breathe. So if they're unable to contract, we can't breathe. This is considered an autoimmune disease, and treatment includes acetylcholine levels at the myoneural junction. Let's see. The tumors of muscle tumors are very rare, but when they do occur, they can be extremely deadly and highly malignant. Rhabdomyosarcoma is probably one of the ones that you may have heard of, and this is a cancer of the of the skeletal muscle, and it requires surgical removal, and there's a very poor prognosis. Let's see, age-related diseases. We have of the bones, we have thinning of the bones, we have loss of minerals, less protein, so it can make the bones more brittle. So as we go with age, it's going to give us basically brittle bone disease. Let's see. Joint mobility will decrease, and so we may start getting more of the arthritis, and that's going to increase. Arthritis chances will increase as we get older. Muscles become less sensitive to different stimulation as we get older, and recovery following a contraction becomes very slow, so we may not be able to gain full mobility. And I believe that's it, so we will stop there.